A critical time in the battle against the coronavirus. Thanksgiving week is here, and health officials say our choices will determine whether hospitals will face the worst possible outcome, running out of beds. It is 10 o'clock. Good evening, everyone. I'm Jeff Gianola.
And I'm Elizabeth Din. Well, tonight we are hearing from a local nurse who is giving us perspective on what it was like to work on the front lines in one of the worst hit areas of New York during the city's notorious spring surge.
Oh, Jenny Young joins us live with that interview and new information from health officials tonight. Jenny?
Jeff, Elizabeth, you remember yesterday Washington reported a record number of hospitalizations. Well, tonight Multnomah County leaders had a meeting with health authorities. Those health officials saying that if case numbers do not start to drop, we could run out of hospital beds by December 1st.
You can see we flattened it beautifully last spring.
During the spring, Oregonians embraced safety guidelines and successfully flattened the COVID-19 curve, relieving health officials' fears about hospitals becoming overwhelmed. But across the country, New York City had become the epicenter of the virus in the U.S.
And we were not seeing a lot of cases. I was seeing that New York was desperate for nurses.
So Portland nurse Kevin Pratt packed his bags and went to help his fellow nurses in New York. He spent 2 months working 84 hours a week at a hospital in the Bronx.
It was just really crazy and stressful. I was on, I think, 4 different units during my time there. And one of them was an all COVID unit. And that was the craziest week that I had there.
Pratt says the COVID patients he worked with were put in an overflow unit.
It was like an old part of the hospital and they opened it up.
The conditions were unlike anything he'd seen in his career.
There were 6 people in a room and the beds were they were ancient. The call lights were just the dinger bells, for like at a hotel front desk.
On Monday, leaders across Multnomah County took part in a virtual update on COVID conditions. Tri-County Health Officer Dr. Jennifer Vine says in the wake of a surge, health authorities worry about the possibility of running out of hospital beds as well as staff.
Everybody is looking at a surge, so we can't rely on outside help in terms of licensed healthcare professionals, because essentially we're all drawing from the same pool.
So Kevin Pratt told us one of the things that is encouraging to know is that we can better treat COVID now than back then during the spring. However, health authorities saying you've got to follow safety guidelines. They say stay home, save lives. Reporting live, Jenny Young, KOIN 6 News.